Hello, hello, hello. Michelle Morar here tonight. Uh, we are going to go over, let me just tell you, Medicare made simple, even your dog could enroll if he had a birth date that he was turning 65 and he had contributed to Medicare, right? Oh, Timmy, am I live? Can you see it? Put it in the comments. Yes, I see you, love, love. Timmy's, I have to coach him up sometimes. Timmy is the reason why I am doing these live Medicare 101s. If you know somebody that is going to turn 65, yes, I see you. yes, yes, I see you. Um, so this is the deal. Um, I'm going to go over Medicare. I'm going to do a quick webinar. This is my schedule. I'm going to do 4 of these a day. 4 of these a day. And the reason is because Timmy has a dream. Timmy has a dream. Michelle has a dream. I need to add at least 400 new Medicare clients before January 1st, 2026, because that's the date that we are targeting. We're targeting that date. There are people that do they do that in a month in AEP, which is the annual election period. And I'm going to tell you right now, in the description, go to my website, www.michellemorar.com, if you would like a consultation. You can call if you would rather call. The number is 336-892-8370. Go to the comments if you would like to learn more. Now, I am going to go over information in this booklet, Medicare and You 2025, and this is the one that I have for the Medicare supplement that's in here. There's some information in here that's not in here. We'll be going over some stuff in here, and if you have questions, put the questions in the comments. And let's get started. Like I said, Medicare made simple, even your dog could enroll if he had a birthday. You notice I used a German Shepherd in the thumbnail? That's on purpose because we have a dog. She's not full-blooded German Shepherd. She thinks she is. She thinks she is, but she's not. Let me just say this. The whole reason, let me go back and start from the beginning. Last year, it was probably around July the 5th of last year that I started my treatment and started the journey with breast cancer. I had gotten, diagnosed like the 1st of June, and they started the treatments and everything the 1st of July. I don't know the exact date. I could go back and look and see, but I mean, it's neither here nor there. We went through everything. But the whole reason that I even discovered, the reason I discovered that I had breast cancer, and this is important, is because I flippantly was thinking, okay, Tim he's looking at retiring in June. And I examined myself, and all of a sudden I felt the tumor. And so, it was world shaking that I experienced that. So instead of Tim being able to retire last year, we had to get through the cancer, and I still had treatment through actually. My last surgery was last May, so I had to go through radiation and then another surgery that they wanted to, because I had the particular gene that's called a BRCA2 gene. They recommended that I go ahead and have the um, fallopian tube, I guess, or surgery for there in case of ovarian cancer. Take my ovaries taken out and stuff done down there. So um, it's been a year. It's been an interesting time. So if you are on Medicare currently and uh, you would like some information and see if if you would like to help us to make a goal, and you're in Oregon, actually, you know what? Yeah, I don't care where you're from. Um, I will even get licensed in your particular state, but I'm currently licensed. I live in North Carolina, Greensboro, and can sell all over the state. And actually, I do. I have clients in the mountains. I have clients on the coast, and everywhere in between. So, but I'm looking at 400 new clients is where I would feel the most, we would feel comfortable with him retiring. And I will give you the best service in the business. If I don't know the answer to a question that you have, I will find it out. I will find it out. But I do know a lot. I have been in doing Medicare since 1997, been in the financial service industry since 1997, so I've been around a while. I know a few things, and I would love to help you. But let's go over Medicare 101. Let me get my, I got to check and make sure that Timmy can see my screen. Let me do this. Oh, I got to go back to that and do the chart at the beginning. Let's see. You know what? I don't know. What I may briefly do here tonight is just go over some things, and I'll just talk about some things. Because Tim, you can't see this can you? Okay. Let me just go over some of the things that I want to talk about. Transitioning from employee to retiree, how to enroll in Medicare, the different parts of Medicare explained, and how to help pay for health care when you are in retirement. And number 5, questions and answers. So a lot of people get confused between Medicare and Medicaid. Medicare is a federal health insurance program for seniors, people 65 and over. You have to actually sign up for Medicare. It is also for people under age 65 who meet certain medical requirements. So if you're on disability, and you have to be on disability for 2 years to be able to qualify for Medicare. Or you have a permanent kidney failure that requires dialysis or transplant, or there's a particular other thing that may qualify you, but you would be able to qualify for Medicare. It is federally run, and that means that eligibility guidelines and service are normally the same throughout the entire country. Now, Medicaid is federal and state health insurance program, so it's a combination of the two. So it varies from state to state quite drastically. Now, Medicare is for, like I said, seniors, people over 65, or if you have Medicare disability. But Medicaid is, you have to qualify typically because you have limited resources. The basics of let's see here. Basics of Medicare. Medicare started in 1965 and it is run by CMS. It's mostly for seniors. There was a Medicare Modernization Act of 2003. And then they had the Affordable Care Act of 2010 that have caused some things to change. Now, it's to keep up with people's current needs. The Medicare Modernization Act was passed in 2003 to make several improvements into the Medicare program. The main changes that came because of the act was switching the name of Medicare Plus Choice Plans to Medicare Advantage Plans and adding more medical benefits such as prescription drug coverage. And then there was other updates in 2010. Like I said, these are resources that you have available to you. Medicare and You 2025 and the choosing a Medigap policy. This is basically from a Medicare supplement plan. If that's what you're looking at, there are two types of plans. There's Medicare, there's the original Medicare and Medicare Advantage plans, just like what we were talking about previously. The main thing that you need to really understand is what happens if you are going to continue to work, just like Tim did, my husband, and is currently working, when you should go on Medicare. You're eligible for Medicare at 65. Some people wait later because they are working, and that's what I'm talking about. Now, if you are already on Social Security, they will automatically sign you up for Medicare unless you tell them not to. And they will send out the card and they'll tell you what you should do. That's if you were to retire early, because the thing is Medicare and Social Security are totally two different types of government programs, but typically speaking, you pay for your Medicare out of your Social Security. Now, you do not have to. Like I said, you can pay for your Medicare by paying for it individually, if that's what you want to do. Typically speaking, there are parts A and B, and part A, if you have enough work credits, which is actually 40 quarters or 10 years of working, paying into the system, then you should be able to get it for free for the part A. Okay. Now, if you do keep working past 65, in this book, let me share with you. I have to take my glasses off here. On page 21, it says, how does my other insurance work with Medicare? This is very important that you understand this. So if you get this in the mail, you're turning 65, they send this to you. It's important to make sure you understand what is going on, because there are different requirements for however many, and what size company that you are in. There are different requirements. I'm not going to go through and read this, but these are the type of things that you can get mixed up on. Now, let's see here. How do you sign up for Social Security benefits? You can go and apply online at socialsecurity.gov. You can do it by phone, 1-800-772-1213. And you can go and apply in person at your local Social Security office. Now, if you do go, you will need to have your Social Security number, your birth certificate. You will need a W-2 or a self-employment tax return from last year. You'll need the name of your bank and your account number for deposits. If you're in the military, you're going to need your military discharge papers, if applicable. If your spouse is going to sign up too, then you'll need their social security and birth certificate, and your children as well. Children, if they're getting social security, they need their number and birth certificate if they are applying. You will also need to provide proof of U.S. citizenship if you're not born in the United States. If you are currently working and you receive your health insurance through your employer, you are not required to enroll in Medicare at age 65. When you or your spouse retire, you will have a special opportunity to enroll in Medicare without a penalty. Do you need to cut? Now, a lot of people, this is what happens. And this is why Tim had to continue on, is because I used his insurance from work, his work insurance, health insurance, and that's the reason why he had to continue on working last year. He's an older man. I am way younger. I mean, you could see, that if you saw us together. You would know that he's the older man and I'm the younger wife. And seriously, I mean, this happens. You know, people are different ages, and sometimes you will have a situation where the older husband is carrying the younger wife, or maybe it's the older wife is carrying the younger husband. And so you will have to deal with those situations because Medicare is not going to cover you unless you are 65. There's quite a bit of difference between Tim and I, our age. So I have to have coverage for me when he goes, when he retires from with the work insurance. So you may have to do some different things. Now, signing up for Part A. Like I said, there's two parts to Medicare. And let me see. I think in this book, yes. On page 10 of the Medicare and You book is where it breaks down the options that you have, whether it's original Medicare or Medicare Advantage. Now, with original Medicare, there are two parts. Part A, which is for the hospital, and Part B, which is for the doctors, and most everything is covered under Part B. You also would need to add a Part D, which is the drug plan. And then if you are in original Medicare, you would need a supplement. Some people don't have it, and that is crazy. That's crazy because you can have a tremendous, there's a lot of gaps that Medicare has, and you could have a lot of money that you may have to owe if something happened to you medically. And let's be real, as you get older, more things happen. You have original Medicare, and you also have Medicare Advantage. That's also known as Part C. And it has both. It includes all the Part A and Part B, but it also has, most of the Medicare Advantages include the Part D in their plan, and they also have some extra benefits. And that's where, a professional like myself, it doesn't have to be me, but someone like myself can help you decide which way that you would like to go. Part A reminders on premiums. Only people who paid fewer than 40 quarters of FICA taxes pay a Part A premium. But if you do not buy Part A when you're first eligible, your monthly premium may go up. Now, there's a caveat, because if you already have employer group insurance that is, qualifies you, that's when you need to reach out to a professional to find out whether or not what you need to do, the steps that you need to do. Now, your start date, if your birthday is on the first of the month, like if you had you were turning 65 on August the 1st, then you actually would have been eligible to get your Part A started on July the 1st. It would be the first day of the previous month, is how that works. Now, if you're taking Social Security and you're 65 years old, you need to sign up for Part A by contacting your local Social Security office, and that's where, if you do want some help with that, contact me and I'll give you the information. Part A, you can sign up during the following times. You have an initial enrollment period that's 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after. Excuse me. There is the general enrollment period, and then there are special enrollment periods. A special enrollment period would be you decide to retire at some odd time in the middle of the year. That would be a special enrollment period. Okay, let's go. If you get your Social Security benefits, you'll automatically get Part B starting on the first day of the month you turn 65. When you sign up for Part B. Part B is Part A you do not have to pay for. Part B, pretty sure, let me see. I have to, I'll tell you how much. The Part B of Medicare is dependent on how much you make. So that would be the standard monthly premium if you are not ultra wealthy is $185 this year. That's how much it costs to get Medicare Part A and B. Like I said, Part A is free. Part B you have to pay for. If you don't want Part B, you can follow the instructions that come with the card and send it back. So like I said, if you are continuing to work, maybe you don't want to start your Part B premium because it would actually be cost you money out of your Social Security or the amount of money that you send back to them. Now, the Medicare supplements have an open enrollment period when you are turning 65. And so you have a 6-month period, 65 or older. You have to have signed up for Part B before you can get a supplement, though. You have a guaranteed right to buy any Medicaid insurance policy in your state. This is very important because if you already have some type of issue, like me, they will not be able to ask you any underwriting questions. So it's very important that you make a decision on which plan you want to go with. And if you're going to get a Medicare supplement, it's important that you know what your rights are. Let's see. Let's go over. If you didn't sign up for Part B when you first became eligible, you may be able to sign up during one of these times: a general enrollment period or a special enrollment period. The general enrollment period is from January 1st to March 31st each year. And your coverage will start on the first day of the month following the month of enrollment. So if you sign up in January, sometime in January, your first month that you would have Medicare would be February 1st. And you could have to pay a late enrollment period, so you need to be careful with that. If you had coverage, then it's totally different. The special enrollment period primarily impacts those who keep working after age 65 and stay on their employer plan. Part B premiums. It is indexed to your beneficiary's earnings. So if you have, well, it actually says on here, the premium, if you have $106,000 or less as an individual, or $212,000 as a joint annual income, then it would be $185. If you have above 106 up to 133 as an individual, and above 212, between 212,000 and 266,000, you would have to pay for this year $259. If you had individual income, annual income between 133 and 167,000, and your joint annual income was above 266, but up to 334,000, then it's going to be $370 a month. If it's above 167,000 up to 200,000 as an individual, or above 334,000 up to 400,000, then you would pay $480.90 a month. And if you're above 200 but less than 500, and as an individual, or above 400,000 and less than 750,000 as joint, you would pay a $591,090 Part B premium. And if it's $500,000 or above as an individual, or 750,000 or above, you would pay $628.90. So the more money that you do make, the more your Part B premium would be. So if you are 106,000 or less, you're going to be paying about $185. But now let me say this: it goes up every year. So this is just for 2025, okay? What are the different parts of Medicare? Like I said, there's the Part A, which is the hospital insurance. There's Part B, which is the medical insurance, which is mostly doctors and any type of, let's see, it's doctor services, outpatient care, medical equipment, some types of therapy, and home health care. Some that are covered with Medicare. It does have some preventive services. Part B does. Mostly Part A is just in the hospital. And then the Part C is the Medicare Advantage plan. They have, they're by private insurance companies. They replace your original coverage of Medicare, and they have typically HMOs, which are the most restrictive, and then they have PPOs. And most of those also include a Part D or drug coverage inside the plan, and they also have additional benefits. Part D is just your prescription drug coverage. Let's see here. You can only get, typically speaking, let's be typical, you will be able to enroll from October the 15th through December the 7th of each year with a new Medicare Advantage or a new Part D plan. That happens every year, and you are allowed to do that. Typically speaking, once you lock it in, you lock it in for the year. There are some exceptions. So if you do have some questions, you're in a plan and you're not happy with it, give me a call. I might be able to help you with some type of plan that you would be available to change with, but there's only certain types of coverage or plans that you can get. Let's see. You have Part A benefits, hospital benefits, deductibles. If you go into the hospital this year, it's around $1,676 for every 60 days. Medicare pays 100% for the first 60 days. If you stayed in there more than 60 days, or if you came in, you went in the hospital, came out, and then another 60 days passed, then you would have to pay that deductible again. So it can be more than just $1,676. If you stayed in there between 61 and 90 days, you would have a copay of $419 per day for the days 61 through 90. That's why you need a supplement if you're going to go with original Medicare. Now, the Medicare Advantage plans work differently, and I would, if you talk to a professional like myself, you will be able to, they can explain the difference and help you to decide what you would like to do. Medicare will pay all but $838 a day for days 91 through 150. And those are your lifetime reserve days. Typically speaking, you're not going to be staying in there that long. That is why a lot of people go in and out so quickly, is because of the Medicare system. Okay, that's one of the reasons why. Skilled nursing facility care. When you have just Medicare, it's different under Medicare Advantage plans, but with Medicare supplements, you have to have a hospital stay of at least 3 days before you can go into a skilled nursing care facility. And then you have to enter a skilled facility generally within 30 days after leaving the hospital. And you must need skilled nursing care 7 days a week or skilled therapy services at least 5 days a week. If at some point that you're not getting better, most of the time Medicare will kick you out of the system and you will have to go into, and that's where you need long-term care. That is why you need long-term care, is because a lot of times they will push you out of the system and you'll have to have something else that you'll have to pay for. If you have a eligible skilled nursing care facility, it will pay, typically Medicare will pay 100% for days 1 through 20. And then all but $209.50 for days 21 through 100. And listen to me very carefully. You need to understand this. After 100 days, Medicare does not pay for your care. And it has to be skilled care. It cannot be, that's where, some people go into a nursing home, and that's where you would have to start and begin to pay for your own care. And if you have questions about some things like that, I can help you in that area as well. Part A benefits, there are blood benefits after the first 3 pints. There's like a deductible. That's where if you have a Medicare supplement, it'll take care of that blood deductible for you as far as paying for it. Home health care benefits for medically necessary skilled and medical supplies. Hospice benefits for inpatient respite care and related outpatient drugs. Part B benefits, like I said, there is a welcome to Medicare visit that you are eligible for when you turn 65, and there are preventive services that you are eligible for. That is not a yearly thing. That is going into Medicare that you have that service. Part B benefits pay for inpatient and outpatient doctor services, surgical services and supplies, speech and physical therapy, diagnostic tests, durable medical equipment, ambulance services. There's most of your benefits are covered under Part B. That's where you will access, and that's why there's a premium for the Part B. The Welcome to Medicare visit, that is a one-time review of your health. You receive education, counseling about preventive services, and you have to go within the 12 months of your Part B coverage. It is not a physical exam. An annual wellness visit, you can have a yearly wellness visit to develop or update your personalized prevention plan, provided for free one time every 12 months, not subject to the deductible, and it's not a physical exam. Some preventive services, the exam like an abdominal aortic aneurysm screening, that's one time only. Breast cancer screening, mammogram once every 12 months. Cardiovascular disease screenings, that's once every 5 years. Colonoscopy once every 120 months, shorter duration for high-risk individuals. And there's a flu shot, which is once per flu season. Medicare will pay for some, but not all of your preventive services. So your doctor may recommend you have certain exams more frequently than Medicare allows, and that's where you could be responsible for that payment. So you got to make sure that you understand that. For the Part B, there is a annual deductible of $257 for 2025. And after you meet the deductible, Medicare pays 80% of eligible covered charges. 100% of Medicare covered clinical laboratory services, blood tests, or diagnostic services, varying amounts for covered preventive services, like I said, and nothing for any charges in excess of the Medicare approved amount. So if the doctor charges you an excess amount, that is where these Medicare supplements would come into play. There are some, like a Plan G, that will take care of 100% of any of those excess charges. What does Medicare not cover? So they do not cover routine dental, vision, hearing, and foot care. They, like I said, do not cover long-term care like nursing home. That's where, if it's not skilled care, Medicare will not cover it. So even if you've been in there less than 100 days and it's not skilled care, then you would be responsible for any of those charges, whatever the amount is that the nursing home or assisted living is charging you. Alternative medicine is not covered. Elective cosmetic surgery is not covered. Personal care, health care outside of the U.S. is not covered unless you have an emergency. I love that they say that, and yet you can get, if you have a Medicare supplement, and even with a Medicare Advantage, if you had an emergency, you could be taken care of in an emergency situation. Prescription drugs are not covered under Medicare Part A and B. That's why you have a separate Part D, which is your drug plan, and then non-medical expenses. There are basically chronic needs and acute needs. Chronic needs are, hospice, nursing home, skilled nursing, home health care, adult daycare. Those are chronic needs. Acute needs are like a doctor office, lab, outpatient, hospital, durable medical equipment. Those are the acute needs. So that's the chart that they basically have. Part C, Medicare Advantage plans. Once enrolled, you are removed from original Medicare if you choose the Part C. The private health plan is not supplemental insurance. Normally, it comes with network restrictions. You're going to either have an HMO, a PPO, and even in some instances, it's called a plan, a PFSS, private fee for service, PFFS. That's what it is. They all have acronyms. That's part of the problem with the chemo that I had. I can't remember some things. Optionally renewable every year. So I love the way they put this optionally renewable every year. That is true. You can have a plan that is good this year and then it goes away next year. Most of the plans have changes. They don't necessarily take away the whole plan. Sometimes they take away the whole plan. But if they do that, then you would have an option to get another plan. But I love the way they put that optionally renewable every year. What do you think happens with Medicare? Each and every year they go up with their copays and code. I mean it's that way with both original Medicare and Medicare Advantage. So I mean it's crazy. Your out-of-pocket costs can change over time. Of course, they will change over time. That is a given. You cannot purchase Medicare supplement insurance to cover extra cost with a Medicare Advantage plan. They do have wraparound plans, but you would not have a Medicare supplement. It's a hospital indemnity type plan that will pay in the hospital in certain situations with the Medicare Advantage. They do have that, but the Medicare supplement, the way that you know it and understand it, does not marry up to the Medicare Advantage plan the same as it does with a original Medicare. That's what they're referring to there. Let's see. Part D. A prescription drug plan run by private insurance companies are approved by and under contract with Medicare, and they help cover the cost of prescription drug plans. They have brand names and generic drugs. The least expensive way to do your drugs is, of course, through generic drugs. You could get some extra help. You may be able to qualify for extra help. But that's where someone like myself could help you to see, or if you go to a social worker, they may be able to help you sign up for extra help. Part D does not cover non-prescription drugs, weight gain or loss, fertility, cough or cold, hair growth, or cosmetics, or most vitamins and minerals. Like I said, Medicare alone may not be enough. Your options to help pay for medical expenses. You have the choice between original Medicare, and with original Medicare, you would be able to get a Medicare supplement, and you would also need a prescription drug plan because you will be penalized if you do not take a drug plan, when you sign up for Medicare. Or you have the option of having a privatized Medicare, which is Part C. Everyone has different needs and situations, and as a licensed producer, I can help answer your questions when we meet. I will help you choose the right solution for you. That wraps it up. I did want to say, again, it's in the description if you would like to go. Let me at least show you. Let me go to my website and at least show you. Okay. Let me do this. Let's share the screen. Don't spud. No. Okay. Okay, this is my website. But this this is where you could put your name, your email, the subject, and a message to me, and then submit it, and that's where I would get back in touch with you. Okay, so it's MichelleMorar.com is the website. Okay, that wraps it up for right now. Like I said, I'm going to be doing 4 of these. Hopefully I'll get better at doing this so you can see. anyhow, thank you. And if you do have questions, there's information in the description. Talk to you soon.